Hello, my name is Dr. Ronald Popper. I am a board-certified sleep medicine specialist and the director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. On a previous YouTube video, I spoke to you about obstructive sleep apnea syndrome. This is a disorder in which patients snore and hold their breath. Patients with obstructive sleep apnea syndrome are at much greater risk for disorders such as high blood pressure, heart attack, stroke, congestive heart failure, irregular heart rhythms, and diabetes, and even sudden death. For the past 25 years, obstructive sleep apnea syndrome has been best treated by a device called nasal CPAP, or continuous positive airway pressure. The way this device works is that a machine connected to the patient via a mask that is worn over the face blows air under pressure into the upper airway, spreading the tissues apart and preventing their collapse. Nasal CPAP has been the gold standard of treatment for the last quarter century. It's virtually 100% successful in treating obstructive sleep apnea, eliminating both snoring and the breath holds in those patients who wear it. The problem is not all patients tolerate nasal CPAP, and not all patients wear it every night. And if you don't wear it every night, you're not going to get the maximal benefit. This has opened up the door for the need for an alternative treatment. And now one is available, and that treatment is called Provent therapy for obstructive sleep apnea syndrome. This is an example of nasal CPAP. As you can see, a mask is fitting over the patient's nose, and it's attached to a pump. This needs to be worn on a nightly basis. This is an example of Provent therapy for obstructive sleep apnea syndrome. So how does Provent work? Well, Provent has these two valves that are held in place by an adhesive strip. The valves open up widely during inhalation through your nose. This allows you to breathe in freely without any airflow resistance. However, when you exhale through your nose, the valves then narrow down, creating a passageway that's very tiny. This creates resistance to your exhalation. This also creates positive airway pressure that backs up into your airway, spreading your tissues, preventing the airway from collapsing, and also either eliminating or markedly reducing your snoring, much in the same way as nasal CPAP does, but without requiring you to be attached to a machine and wear a mask. So what patients are best suited for Provent therapy? Well, in my practice, we have three categories of patients. First, the patient who is newly diagnosed with obstructive sleep apnea syndrome and has no interest in even trying nasal CPAP, surgery, or an oral appliance. Second are patients who try nasal CPAP and either don't tolerate it or find it too cumbersome to use, or just simply won't use it on a nightly basis and therefore won't get the most benefit from it. Our most popular category of patients are actually the patients who are using nasal CPAP, tolerating it fine, getting the benefit of nasal CPAP, but they just hate to travel with CPAP. They have to lug it through the airport, they have to open it up when they go through security. It's cumbersome, it takes time. Frankly, it's just a pain. So these patients often want to try an alternative treatment for when they travel. Provent couldn't be a better alternative. If Provent works for them, they can take a weekend vacation, they can take a week-long vacation, they can take a month-long vacation and not have to lug around their nasal CPAP and still get the benefit of effective treatment for their obstructive sleep apnea syndrome. So thank you for watching this video. Sleep well tonight and have a better day tomorrow.